see all you guys. So thank you for joining us. And so who's new to our monthly seminar? Wow, great, awesome. Good number of you guys. And some of you guys have been here before. Who's been here before? Welcome back. So great to see you guys, and thank you again. I know it's a busy holiday season, but love to share the information with you guys. So great to see you guys. Okay. I only have a few slides just to make an introduction. Today, Dr. Orson Rodriguez, our family practitioner, will be providing the lecture on whole food plant-based lifestyle. Also today, it's very exciting. We have Dr. T, who is going to be doing some food demonstration. So you guys are in for a great treat. And so I think the food is almost getting ready. So my name is Dr. Douglas Swan. I'm a spine surgeon, but I'm with Lumen Health, and just to got to thank Lumen Health and Star Medical Center for allowing us to utilize the space. Lumen Health has, from specialists from orthopedic, spine, pain management, GI, gastroenterology, all the different subspecialties. Also family practice. We have multiple physicians, but also Dr. Orson Rodriguez is our plant-based family practitioner. I'm a minimally invasive spine surgeon, and you may think, what's a minimally invasive spine surgeon talking about nutrition? Because it's one of my passion. And also my passion is studying the longevity and regenerative medicine. So it really ties into a plant-based diet and lifestyle. And also, one of my big things is, in my line of work, I do minimally invasive surgery, and I do a lot of them, which means I get exposed to radiation every single day. I wear protective lead, both the full vest as well as a skirt. But I still get radiation. For a patient, it's a one-time event. For me, it's every single day. And so chance of me getting a cancer in the future is much higher than somebody who's not getting exposed to radiation. So it's a profession that I chose, so I can't do anything about it. But what I can do about it is do everything that I can to prevent getting cancer. So I mentioned this last time, but every single one of you guys who are sitting here today have cancer. You may say, what are you talking about? But if cancer typically minimally takes about 20 to 30 years to grow before it really shows itself. So we have to do everything that we can to prevent ourselves from being defeated by cancer. Okay? So anti-cancer prevention is the key. Okay? And you have to start, basically when you're an infant. And many of us didn't get exposed to plant-based diets early on. It's never too late. So we got to start now. Okay? So my portion is very short, and I just wanted to kind of give you a taste of what we might be talking about in January and February. And with anti-cancer, the most important thing is your diet, what you put in your mouth. So diet, mostly plant-based. Be better if it's all plant-based. Okay? It's more important to, some people focus on what you don't eat. I think it's all about what you do eat to fight the cancer. Okay? Also, exercise. Some people say moderation, 30 minutes. A lot of the articles, and if you talk to the people who wrote the articles, say 30 minutes because no one's going to do 60 minutes or 90 minutes. But you really do need to know exactly what you have to do. So the best result is 90 minutes of moderate activities or 40 minutes of very vigorous, intense exercise every day. That's the best way to beat the cancer. Okay? And what you do with it, afterwards, if you can only do 30 minutes, hey, it's still a heck of a lot better than not doing anything. Okay? And then also stress management. So in January and February, we're going to be introducing mindfulness meditation, because I really want to help everyone prevent cancer in their life. And the stress management is very, very important. And so we are going to have the CEO of Lumen Health, who practices mindfulness meditation, to come give us a lecture and then also teach everyone how to properly meditate. So if you guys are interested, look forward to that in both in January and February. Avoid toxins. And so we don't really think about all the toxins that we utilize day to day. Fragrance, different types of cosmetic products, bug spray that we use at the house. All those things are just filled with toxins. So just have to be mindful of it. And this is a little bit variation from Dr. Furman. He talks about G-bombs to prevent cancer. And so, but I added, based on my research and reading different papers. And so G-bombs so that we can easily remember. Okay? G stands for green, according to Dr. Furman. But green, it's cruciferous vegetables, right? Like broccoli, cauliflower, kale. But also I also added garlic and green tea, and beans, and the onions, and M for mushrooms, B for berries. It's something that I try to consume every single day. And then the seeds, especially flax seeds, and then the spices, such as turmeric. If you're going to use turmeric, you want to make sure you utilize black pepper, because black pepper helps retain more turmeric in your system. Ginger, and garlic, and as well as soy. There's a lot of a myth about soy may be bad, estrogen. Those all been debunked. And so those are the people who really haven't read the papers. So there's so many papers that's out there that soy helps you prevent cancer, and if you do have cancer, that it's going to help you fight the cancer. Okay? So this is what I do every morning. This is my typical routine. Every morning, I get up at 5 a.m. and I exercise for an hour, an intense workout. And then after that, then I make myself a smoothie. I call this a super smoothie. This is basically a smoothie that I designed to prevent cancer, but also to fill my body with nutrients so that it helps with my heart, fight cancer, and then also to help grow muscle. Okay? And so typically it has a lot of greens. I have kale, spinach, and collard greens minimum. Okay? And then I also have carrots because I like carrots. Beets, very important, especially for your heart health. And then also for stem cell generation, because it has nitric oxide. And then the seeds. I have flax seeds, chia seeds, hemp seeds, and pumpkin seeds, and walnuts. Spices, I always have turmeric, black pepper, and ginger, and then the berries, blackberries, and then goji berries. And amla, I briefly mentioned that last time. Amla, which is an Indian gooseberry. There's several different kinds of gooseberries, but you want to get the Indian gooseberry powder. This has more antioxidant than anything that we can consume. 50 to 100 times more than blueberries. Okay? So it's one of the best substances that you can take as antioxidant. I also add lemon, and then typically add soy milk, but sometimes I mix it up with pea milk, or even if I don't want to make it really thick, then I may just add water. And then depending on how I feel that day, I may add on different flavors. I may add additional bananas, apple, mango. So try to change it up. But at least this is a basic ingredients that I use every single day. So, and some of you guys may try it, may not like it, and you can make your own variation. But this is everything that you need in order to fight cancer. So, and then I'm going to be I'll put this in our support group. So we just started this month, about a week and a half ago. This, as we mentioned before, this is our Facebook support group, and hope you guys would join. We'll be adding on topics that's really related to medicine and some recipes. You guys can ask us any questions. Myself, Dr. T is also on it, and Dr. Rodriguez will be happy to answer any questions. And then also it's support group among all of you guys. And so I know there are several different ones out in the community, but this one is really geared towards medicine and how we can improve our health, and then also fight the chronic disease. And so, but all topics, as long as it's friendly, it's welcome. Okay? And so one of the things I noticed in some of the different groups is it can be some groups can be divisive. And I think one of the things that's going to be very, very important, not only for plant-based vegans, is to show compassion, whether they're full vegan, or somebody who eats, animal proteins. And so, one of the, I think, most important thing is we have to show compassion. So we want to make sure that our support group, shares that also. So, and, I answer all my own, questions. I get a lot of questions on my Facebook, Instagram, Twitter, and so join, follow me, and then, or you can direct message me, or you can ask questions in any form. I love interacting with patients and anyone who has interest, whether it's in spine, health, plant-based diet, and so I'm always available. So if you're interested, follow me. So that's it from my end today.